Okay, I want to tell another story about how you can help your clients with abdominal manual therapy. This is a story from my old clinical practice in Seattle, a long time ago now. And it's a story about a client who came to see me. So she was a woman in her mid 30s. She had a couple of kids, and she had been having a problem since her last child. So she didn't have any cesarean sections, but with her last child, she had some very unusual tears that happened during the birth, and it was described by her doctors, and she described it to me. She came to me originally for problems with her urination. She basically had incontinence. That was the primary symptom, and it happened when she laughed or just at random times, if she stood up or sat down or things like that. And it had been a problem for her for at least 6 months, and I believe possibly longer than that. She came to me after having exhausted a number of other attempts to treat this problem, and one of her complaints was that she couldn't leave her home for long periods of time because she had to use the bathroom so frequently for urination, and she also had regular unexpected incontinence with sneezing or laughing or other things like that. I did an extensive medical history, which is how I normally start. And then I started working in her abdomen, which is the other first thing that I do for treatments. And shortly after starting, I did notice a couple of different things. So, one thing is that I noticed while I was working in the upper part of her abdomen, it felt very weak. There was no muscle tone in there. It actually felt kind of empty. And then as I progressed around towards the side and the lower part of the abdomen, below her navel, it felt very dense. And as I continued up the other side, I noticed there was a change, and towards the top, it started feeling very hollow again. No density up there, or not what I would expect for normal density. And so, what I decided was probably happening was a version of what they call in Asian medicine. They call it by a word that normally they translate as prolapse. And in English, that has actually a couple of possible translations. There's another English medical term. It's a little bit outdated, or it's not used as frequently now, but it's called ptosis. It's Ptosis. And ptosis means that something that should be in a certain position starts to droop. And in English these days, it's mostly referred to. I've heard it in two contexts. One is if they just talk about ptosis, they often mean a drooping of the eyelid, almost like a paralysis or something. But it's something that's very noticeable. I have seen it in actual clients. That's the most common usage that I found for that word in English. Like I said, it's kind of an archaic word. The other context that I often hear it in, and in my original acupuncture school, we often heard this term that was 40 years ago, and these days I don't hear it as commonly, but it's called gastrotosis. And that means that the stomach itself is drooped or collapsed. So that can happen for various different reasons. One of the more common ones that I found in my practice is with bulimia, that from kind of over time expansion, overexpansion of the stomach can lead to weakening of the stomach muscles and therefore kind of a collapse of the stomach. I'm sure there's other reasons that would happen, possibly some medications, possibly some other reasons. So in Asian medicine, there is this condition. You could call it a condition or you could call it a syndrome, I guess. But it means where the organs that should be in a specific place start to fall. That's the beginning. And again, in English, we could call that ptosis. And there's a kind of a range from ptosis on one end to prolapse on the other, where the weakening process begins, the organs start to fall more and more and more, and at a certain point in Western medicine, it would fall under the category of prolapse. So a prolapse can get so severe that the organ literally starts to protrude from the body in the case of, for example, a uterine prolapse or a bladder prolapse. But somewhere on that spectrum from beginning to fall to a full-on prolapse, there's a wide range of conditions that you can find with using your hands diagnostically in the abdomen. And in this woman's case, that was the first thing that I noticed, that the upper part of her abdomen felt empty and the lower part of her abdomen felt very dense and full. And so I started working on things. I started focusing on getting underneath and lifting things, vibrating as I normally do, and during the course of the treatment, I could feel things start to separate and certain things start to shift their position, and the mass in the lower abdomen started to feel like I could feel the spaces in between better, and things started separating from each other. And as I continued working and lifting, things started to even out. I probably worked on her from 45 minutes to an hour, possibly longer. But by the end of the treatment, I didn't feel that difference between the upper and the lower abdomen anymore. And then when I finished the treatment and I felt like everything was more or less evened out and more or less back where it belonged in her abdomen, I did a stretching technique, which I teach in my online program, where I grab the skin of the belly and lift in a specific way and use that to pull on the internal organs. And I go into more of an explanation of that in the class. But that was how I ended that first treatment. And she came back to me within a week, and she said that her symptoms were 90% better from the first treatment. And the second treatment that I did was very similar. I didn't find things drop down as much, but I still did a lot of lifting. I still did the stretching at the end. And I'm pretty sure that I probably also did some moxa in her navel. It's a treatment from Asian medicine that's used for lots of different things. And in her case, I was using it to support the organs staying in the position that they wanted to be in. So anyways, I saw this client, I believe 2 or 3 times. After the first time, her symptoms were 90% resolved. After the second time, it was pretty much 100% resolved. The third time, we did a follow-up, but that problem wasn't there anymore. I didn't see her again for at least 6 months. And when she finally came back 6 or 8 months later, She did say that the symptoms were starting to recur a little bit, and we did another treatment, and then the treatment stayed away again for a very long time. I think I lost track of her after that. So that's another one of my favorite stories to tell about the value of doing abdominal manual therapy and the kinds of things that you can learn once you're trained and once you have an understanding of what really happens in the belly and how to treat it, how to evaluate and treat it with your hands. So thanks for listening to my story, and I'll be back with more.